Hello, everyone. Again, another episode, this time part two of Breaking the Silent Sleep Apnea. I have together with me Dr. Nolido and Dr. Montalban. How are you today? How are you both?
Good,
We're
Julio. How are
good.
you
We're good.
today?
Thanks.
Very good, very good. So, this is very exciting. Today, we're going to go over some very fluid things that most people haven't seen yet. We're going to start off doing a small resume of what happened, of the most important parts of part one. And today, we're going to go over all the parts of treatment, all the parts of scanning, and everything else. And I have the doctors here that will talk us through.
Sounds good.
Thank you. So let's go over of the most important part of last part one when we passed through when it was diagnostic a patient with sleep apnea and what are the parts of the afterwards after that.
So, you want to start? So usually after the diagnosis, we get a sleep study from the doctor, and we call the patient in to review the sleep study with the patient. And usually it's a very a lot of information is in the sleep study, but for us, for our purpose, we really concentrate on certain things. We look at the AHI number, the RDI number, the snoring, how loud the snoring occurred, and how long they were snoring for. We also look at how low their oxygen went and how long they stayed down there. So those are the parameters we look at. I think it's important to kind of go over some language,
Sure.
explaining what the HI is made out of and what the RDI number is made out of. So, do you want to take that? Yeah.
So like she was saying, when we get the report back from the doctors, usually the one that we do, that's a home sleep test, we receive a study report. So everything is already outlined there. So we're not the ones who are actually interpreting the report. We're just reading it off to the patient and explaining to them the importance of what was found. And first, they go over their pre-test risk of having OSA, because that's important for them to know. Even in the report, they ask them a series of questions. It's called an Epworth sleepiness score. So they'll ask them questions like, how likely are you to fall asleep when watching TV or sitting in traffic or talking to someone? And there's actually numbers that are associated with that. And so that will determine their risk. And that's also part of the report. That's the kind of the first part of the report. And it also goes, when we're doing our screening, we talk to them about this as well. And it also will indicate their daytime sleepiness and the probability that they have OSA, or obstructive sleep apnea. And then it goes to what the test found. And like I said, we do a home sleep study that is shipped to the patient, and they just follow the directions. They put it on their heads. Unfortunately, we don't have an example of that, but they put it on their heads and connect it, and they usually do 2 nights of that. But the alternative, or what they used to do years ago, was you have to go to a clinic, a sleep clinic, where someone will watch them. But that's very difficult because people say they don't really sleep there. They're laying in the bed that's not their own. They're not comfortable. Even if they turn down the lights, they're strapped to all these things. Somebody's watching them. So for a lot of patients, they don't want to do this. They're resistant to do this, and then they're not able to get diagnosed. So the availability of the home sleep test is a great thing. And that's why we partnered with Watermark Medical here in the United States, in order to provide that test to our patients, and then they have doctors that will interpret the results of the data that they receive.
Sure.
I just
So,
go ahead.
so
I
we
just
go over to the CPAT or
Not
well,
yet.
I
So
just
not yet.
yeah.
it's a review.
Yeah, I could actually explain a little bit of how to read the for our purposes, we don't go into the little tiny details, but for us, we look at the AHI number and the RDI number. It's very, very important. So just to give you an idea when we're looking at it, so apnea, if someone has apnea, that means they have no air whatsoever for at least 10 seconds and their oxygen drops down. And hypopnea is partial air for at least 10 seconds, oxygen goes down. And there's another number that you can look at. It's called RERA, respiratory effort related arousal. That means the brain woke them up, but the oxygen didn't necessarily go down. So when we're looking at the numbers, when we look at AHI is basically apnea and the hypopnea numbers put together, added together, divided by the number of hours they slept. So that gives you an idea of how many times they lost air or partially lost air, and how many times that occurred during the hour, every hour. And then the RDI will put the apnea number and the hypopnea number and the RERA number together and how many times that happened within an hour. So we can kind of talk to the patient about.
So this happens to a patient at any time of the day, or just specific time when the patient is sleeping?
It's it's usually when they're sleeping. So say a patient who so there are different. So if we look at the AHI number, there's mild, moderate, and severe. So mild, an AHI number of 5 to 15 would be considered mild, and then 15 to 30 is moderate, and then 30 and above is severe. So 30 and above, we will be sending you to see a pulmonologist or an ENT, someone who could, definitely look at a CPAP option for you.
Okay.
But say someone who is 7, that means they were sleeping and they lost air partially or fully at least 7 times in each hour while they were asleep. So that's quite a bit. So if you close your nose and close your lips and try to breathe for 10 seconds and you can't get it in, that's basically what they're experiencing. For that 10-second. Yeah. Mm-hmm. So if you try it, it's actually quite scary.
So it's so obviously this affects the brain, affects all the organs, and all your movements, all your
absolutely. Yes. Yeah, for sure.
So some of the other things that the report will also show are what's called minimum oxygen desaturation. So it's the percentage of time that you're not getting enough oxygen. So when you go to the hospital and they put us this little probe on your finger, it's to show how much oxygen is going through your body. When you're awake, it should be 95 to 100%. When you're sleeping, it still should be close to 95 to 100%. The minimum amount that anybody wants to be at is 90%. So it will, the test will also show if the patient is going below that. So that's how we can explain to the patient the severity of their apnea and hypopnea. And exactly like what Dr. Nolido was saying, that if their oxygen saturation goes below 90, if they hold their breath, it takes them a little while to get below 90 for their body to not get that 90%. And then they can really feel what that feels like. And then that's what's happening while they're sleeping, that their brain and their body is not getting that oxygen there. So that's one of the criteria that's on the report. And then there's also snoring, which it'll tell. The report will also give the percentage of time they're snoring very loudly which is anything over 30 decibels, which is pretty loud, which means it could be disruptive to bed partners.
Yeah.
So that is another criteria that the
I don't think anyone want a buzz next to the ears.
right,
Hence
exactly.
the 25% of people sleeping in separate bedrooms.
Right, exactly.
Yeah.
Exactly. So, and then the other criteria that it will show is how often their heart rate changes. So when you're sleeping, your heart rate should be pretty steady. If you're resting, right, you would imagine that it's pretty steady and calm, and you're calm because you're sleeping. When you're having these episodes of apnea and hypopnea where you're not getting enough air, your heart actually ends up working harder in order to get that oxygen into your body. So your heart's not resting at night the way that it should also, which is why sleep apnea can lead to heart disease and heart problems, because there are these variations in the heart rate that happen when your oxygen goes below 90. And depending on how many times that goes below 90, that means your heart is working much harder. So that's a very important thing that we talk to our patients about, so they can understand the severity of their sleep apnea.
And of course, during this stage, there's also high risk of other things like possible strokes or tachycardia or things related to the heart, right? Because of the misfunction.
Absolutely. In fact, I had a patient recently that was referred to us because they had some what's called atrial fibrillation, where their heart kind of fluttered a little bit.
Okay.
And the cardiologist said to them specifically, you should be tested for sleep apnea, because that could have led to that, even though they had no other history. And I don't even know if he had a history of snoring necessarily. So he would have never thought to do any kind of test, but the cardiologist actually referred him to do that. So he talked to us about that.
It's no, it's just very significant for people who are going to be listening this, that this is serious. It's something not, because people just think, it's only apnea, it's only this, only that. It's very serious. It's very serious because you don't realize that if you don't have oxygen in certain moments of the day, or parts of your organ are not working properly, in the end, it's going to be a breakage, right? You are forcing, comes to a time that the forcing is going to blow up, right? Kind of a explanation, because it feels like you're putting a screw. So there's always a gap in the screw because it's not well fitted, and you keep on pushing it instead of removing and putting a new one, and then in the end it breaks, right? So for people to understand that this is really serious, we get to that stage, or if you feel any of these symptoms, you should go and see a doctor and get medical attention, because think about others too. I mean, we only talked about if you fall asleep just after eating, because it's most prominent when you are doing digestion and you have those symptoms of sleeping because you don't sleep properly. But also when you're driving, it's very common that people with apnea, that they fall asleep. It doesn't matter if it is during night or during the day. It's just an action itself and the movement you do, because it's kind of boring. It goes to that, to that sensation that people are driving, then suddenly and they don't even realize. And imagine that you go on the road with sudden speed, and then suddenly you fall asleep and you turn the wheel and you go to the other side and you make an accident. So think about that.
Actually, there was a study that showed about 12% of sleep apnea patients get into accidents, car accidents. Yeah. If you think about it, if you're
a friend of mine, he passed away. In the end, he passed away for a different reason, but he had a severe accident. He was on the motorway over 120 kilometers per hour.
Oh.
and on the motorway in the middle of the night, he just crashed asleep, according to the doctors, after the all analysis that they done. Then he went to the bumper, and the car gave two pirouettes and went to the other side of the other road. And that was it.
That's terrible. Oh, yeah.
It's just an example for people to be aware the severity of what can happen.
Yeah.
This is reality, and in
Yeah,
the
if
end,
you think
we
of
need
like
to
all
think
the
about others.
yeah, if you think yeah, definitely if you think of all those train conductors out there, right? Or truck drivers, they have
Yeah.
sleep apnea, they've got
I'm not sure. I mean,
yeah.
you as experts, if you could tell me. I mean, I was told that people are spend a lot of time because they don't sleep properly, like truck drivers and all these people that have this type of work. They are
Mhm.
most prominent to have apnea. Is that kind of true, or is just a myth? Or
Then there could be a relationship there, but I do believe some groups are now testing prior to hiring. So I know there was an accident several years ago involving a train conductor.
yeah,
So I think after that, I do believe that some companies are now are testing. So
a train?
yeah, there was a train there. It was a question as to whether that was a potential,
Yes.
potentially involved in the in
I
terms of
believe.
why.
And
Yeah,
I don't know
that.
in US if they are now doing it, but in Europe there's always two drivers.
Oh,
So
really?
yeah,
No,
all the
not
time.
here.
Oh,
Not here.
interesting. Yeah.
In long distance train, in metro we don't see so often, but it's mostly automated already.
Oh,
So
yes,
there
that's
is
true.
something the computer
Okay.
itself stops.
Wow.
So yeah. So in
No
case
falling
of
asleep there.
train long distance, they have two drivers in case of
Yes,
something happens to
that
one,
makes
the rest of
sense.
the other one. Yeah.
Right.
Yeah, just like the
I
airplanes, right?
I think a lot of these professions where they have to be transporting people or
Yeah.
even going on long drives, they do that is one of the questions. And I believe that if they do have any signs and symptoms of sleep apnea, that they will need
Mhm.
to be treated. Otherwise, they
Yeah.
will not be able to hold the license to do
Mhm.
that job. But that doesn't necessarily mean that they're more prone to sleep apnea. I think
Mhm.
that just by the nature of those jobs, they
Yeah.
might not get enough sleep. So that does
Mhm.
not necessarily lead to sleep apnea. However, if they have sleep apnea, that's what a lot of these companies want to make sure that their drivers do not have it, because
Mhm.
that would increase the probability of accidents there.
Right.
So I don't think it goes the other way around. I think that they want to make sure that their drivers don't have sleep apnea. So
I do feel that lack of sleep promotes health risks for sure. Yeah.
I
So
mean,
and
even
health.
if a person does not have apnea at all, if you don't sleep and you go driving,
Yeah.
it's
yes,
already a risk
Yeah.
because
absolutely.
It's like
by
driving
nature
drunk.
itself, you can fall
Yeah.
asleep by itself
Yeah.
anytime. So
Absolutely. For sure.
it's just a matter that some people are still unconscious what they're doing. I mean, I
Yeah.
know in some countries, in weekends, I saw people driving drunk. I saw
Well.
people driving with no sleep. I
Yeah.
saw. I said, "Why are you doing that?
Hmm.
You have no idea what you're
Yeah.
doing. You are risking yourself and the other person." And I say, "Ah,
Yeah.
you're being melodramatic. Melodramatic.
Yeah.
Amazing. Listen, I had some drinks. I take a cab and I go home. And if I go
Right.
out and I
Yes.
know I'm gonna drink, why should I drive? And there's no drink
Right.
and drive. That's that word, right? That
Yeah.
you learn when you take the driver's license. Don't drink and drive. It's very simple. And everyone's
Drive in a
doing the
straight
opposite.
line.
You know,
Right.
it feels like please drink and drive. That's what they're doing. In the end. So,
Right. Right.
but yeah, I mean, I see this quite often, especially during summer seasons. I mean, you go to touristic resorts, you go to countries that most rely on tourism.
Mhm.
Well, let's not go far. I mean, you can go to the for example, in Florida, Miami area, all that part. You see this
Yes.
also. It's just kind of those things that people need to start, changing the script. So if
Yeah.
you know you're gonna go out and you're gonna have some drinks, drop your car at your
Response.
garage or whatever, take a cab and go. And
Yeah.
then you come back. I mean,
Yeah.
there's not much safer than that. I mean, why
Mhm.
you should risk yourself if you go out to have fun? Then the fun can transmit to something else. That's
Right.
all we do.
Right.
Ability. You're always dramatic. You're always thinking about things that can happen. It's not about things that can happen. Why should I risk myself knowing
Yeah.
that it can happen? So I don't even think about it. I just grab a cab and go. But
Yes.
people are always the things that, why should I spend some money on taxi when I have a car? Yes, but you're gonna drink, and
Mhm.
if you drink, even if it's not much, you can get alcohol control, and then you get your license removed. Why you should do that?
Yeah. It's not worth the risk.
Exactly, but I'm just saying this to phrase because I saw this hundreds of times,
Mm.
hundreds, especially
Yeah.
in islands, in touristic resorts. Everyone's doing it. I said, my God, it's amazing that there's no so many accidents because this is
Yeah.
like playing the lottery.
Yeah.
You're driving with someone, you don't know really what's going to happen. And then they speed on top of it. It's not
Yeah.
about they already drunk and drive. No, they speed also, on top of it. So it's like, it's really playing lottery. Why? And then
Yeah.
people get surprised that, oh, there's still thousands of accidents around the world. Yes, because people don't even think,
Mhm.
that's the main reason. You should think before you do something.
For
Absolutely.
sure.
And the other part is, humans, in general, they only take action after something had happened. For example,
Yeah.
something happened and then they take action on that. If you already thought about it and
Yeah.
you presume that something can happen, why not take action before it already happened?
Yeah.
No, it already happened, and then they take action on that specific thing. And said, then everyone doing a big drama said, "Well, this thing happened." Yes, but
Mhm.
it could be avoided, and then
Yeah.
it shouldn't happen.
Mhm.
So you only take action after it happened.
Yes. So
And this
some
is
people like risks.
it's. I mean, but you see this over and over again
Yeah.
in many areas. It's not
Yeah.
about just one
For sure.
specific area. You see it everywhere. For example, the regulations on airplanes, the regulations we have now is because the amount of accidents were before. So now
Yeah.
it's reduced because it happened. But
Right.
if you already knew it could happen, why you should not imposing those regulations
Yeah.
before it happened?
Yes.
And this happens with everything. It happens in telecoms, for example, when there was some excess of radiation in well, we're talking about in the 90s, but it happened.
Oh.
People knew there was a risk, the high radiation on the antennas. Then they reduce it and make it all fairly and all regulated after it happened.
Oh.
So exactly. So this is what
Right.
I'm saying.
Yeah.
Don't push it. You don't need to push it. If you know it can happen and you are prone to something, just avoid it and to make sure it doesn't happen.
That's true. Yes.
And I mean, but unfortunately, most people don't think like that, and this is a major problem too, because
Hmm.
people don't think and say, "Oh, I have an headache." So how long you have an headache? For 4 days, and you don't go see a doctor. You think it's normal?
Hmm.
Don't you see that your body is reacting to something, and you
Yeah.
don't not normal for you to have fever for 4 days in a row?
Right.
And this is happened. They said, no, it's no big deal.
Yeah.
You've been with fever for 4 days. It's not like big deal. You should go and check it. I mean, if you have a flu for one day and then it passes, okay. But if you have it for 4 or 5 or 6 days,
Mhm.
and you keep
Yes.
on taking, fever pills over and over again, it doesn't stop, and you still don't go to a doctor. I mean, it's
Yeah.
stupid.
Yes.
But this, I'm telling you about this because I saw it happen too. So
Yeah.
I mean, it's the things
Yeah.
you see that things are happening. You should avoid to make sure it doesn't get worse.
Mhm.
But
Right.
it do not
Yeah.
happen like that.
Yeah.
Right. The difficult thing with sleep apnea is that it's so chronic that it doesn't affect people immediately.
Right.
So that's why they don't think that it's so important, or they're young and it's additive. It gets worse as they get older. And they don't realize the correlation there. So like you're saying, they don't treat something until something happens, but because people don't understand the correlation between the snoring and the possible sleep apnea to the rest of their health, that's why we're talking about it. They might not necessarily do anything about it because they don't feel it immediately. They don't feel the immediate consequences of it. So they just think that it's nothing. So exactly like you said, that's why we're so passionate about bringing this information to people, if it's a possibility, so that they can perhaps increase their life expectancy.
I mean, I think in a way, people might not realize about the snoring or some of the facts, but for sure they'll feel that they are tired, right? I mean, because when you want to sleep, you already have that feeling for quite a length of time.
Exactly. Like I think I mentioned the last time that people think, oh, it's just me. This is my normal. And they kind of like think, they don't know what it feels like to have full air and full sleep and all that. They just say, hey, this is my normal. This is what I'm used to. So yeah, it could be better. You could live longer. So yeah.
Yeah, definitely. But not only that. I mean, imagine if you do high risk work, for example, you
Definitely.
are working with a crane. You
Yes.
are, imagine,
Yes.
you fall asleep when you are holding the handle, and the
Yeah.
whole container can fall off.
Yeah.
It's an example.
High risk
Right?
work. Yes. Yeah. It definitely affects you. And I think, just people just, need to be open to, maybe a sleep test. And usually by the time the patient takes a sleep test, they've already kind of like, something's up. By the time we're explaining it to them, they're already like, their ears are already open.
Yeah.
So there's a few that are still kind of, I'll hold off a little bit. But by the time we've taken the sleep test, they've already opened up to the idea that maybe they need to, check and look at, other possibilities. Maybe they don't have to feel so tired in the morning. They don't, have to be so sleepy. They don't have to be so irritable or foggy, during the day, things like that. So, yeah.
I mean, also imagine. I mean, of course, not all people have the same level of irritation, of course, but some do, especially the ones that don't sleep much or they get irritated. Now imagine co-living with a person that is always screaming. It's like this
Yeah.
is madness. So
Yes.
and most people sometimes don't realize that they are screaming. That's the worst part, and they don't want to admit they were screaming. And this is the other part. So you also need to have a balance within you, saying that did that actually happen? Did I actually scream? Why did I scream? And ask yourself what is happening and why you done that
Yeah.
and what was the reason of that. In
Yeah.
the end, you go all the way down to the reason that I'm not sleeping properly. Why
Right.
I'm not sleeping properly.
Right.
So
Yeah.
this is the main awareness of people should think. During their life, when they're during their journey or whatever they're doing, that it affects not only them but also other people. And of course, if
Yes.
people starting to get away, of course, because no one wants to talk with the person or be with the person who's always screaming or irritated or cannot
Yeah.
sleep properly because of the noise. So I mean, it's unbearable, right? So
Right.
and that's the part they should think about. Why people are getting away from me, because this has happened, and this is when they should think, okay, I need to go to a doctor
Yeah.
and check
Yeah.
myself and
Yeah.
get a resolution about this.
Right.
But,
The loved one also who's not getting sleep because of the
yeah,
snoring is also irritable
of
potentially.
course,
So
of course.
right.
I
Yeah.
I have a question though. is there a chance by this factor, because the other person is not sleeping properly, that will be having apnea in the near future because of not sleeping, or is non-related?
I think again with sleep, because if you're not getting your deep sleep, if you're waking up and you're next to someone who's snoring maybe 60 decibels, really, really loud, you know, you want
Right.
a whisper, which is 30. You're not getting sleep, and you're not getting your deep sleep, and you're not getting the good hormones that will say protect you from overeating, things like that, and you gain weight. And if you gain weight, your tongue gains weight. And then when you go to lie back with a larger tongue and it collapses back a little bit, your airway's affected. So I'm not going to say not absolutely not, because there's potential there for sure. Yeah.
Okay. Okay.
Yeah.
So, doctors, shall we go over now the
Oh,
part of the scanning and
sure.
CPAP,
Well,
or
so the gold standard, if someone is the first treatment option that most doctors will recommend for patients with any kind of sleep apnea, even a mild sleep apnea, mild, moderate, or severe sleep apnea, is a CPAP machine. And CPAP stands for continuous positive airway pressure. So basically what that's doing is it's blowing air into their mouth, nose, face somehow. And we're going to show a video on that.
yeah?
So this is an example of a CPAP machine and what it looks like. There's the hose. This is the actual machine, power cord, and the mask. So this one is a nasal and oral mask. A lot of them have some sort of water reservoir for like a humidifier so the mouth doesn't get dry. So you use distilled water to put that into the machine. And then you have to connect the hoses, power cord, and then the mask. And then the patient puts the mask on, and that's how they end up having to sleep. And usually a lot of these now will be variable. It's going to turn it on, and you can hear this is kind of what it sounds like, which is a lot quieter than what it used to be. A
Okay.
lot of these machines now have apps associated with them to tell you how compliant you are with wearing it, whether or not there's any seal breakage or anything like that. There's all different kinds of machines. Some of the machines are just nasal cannulas, which is just goes in the nose, so they don't have that whole big thing. But a lot of times they'll use something for the nose and the mouth, because usually if air goes in through the nose, the tendency is to open the mouth, but it's still not opening the airway. So that pressure from the machine is what's keeping the airway open. So, but you could hear that's not really the most comfortable for a lot of patients. A lot of patients have a hard time sleeping with it. But again, as far as we know, it is the gold standard for what will treat sleep apnea, but compliance is what's difficult. Compliance is low. I have to say that I did have a patient that they said when they were using a CPAP machine, once they started using it, not only did they feel more awake, their nails started to grow more, their hair
Right.
started to grow more. It was a male, and his facial hair started to grow more. So that was proof positive that getting more air sleeping actually enabled his body to regenerate more at night. So that was almost for him an immediate proof that he did have sleep apnea. He did have severe sleep apnea. And so therefore the other options were not for him, but he had to use a machine, but the machine did help. So, but again, for a lot of patients, it's difficult for them to sleep with it. It's difficult for them to get used to it because it feels like a tornado is blowing into your face.
Yeah.
I've
Right.
actually tried it, and it's you almost have to breathe against it. But nowadays they have ones that are more comfortable and are more variable to your natural breathing versus a constant pressure there. So, but that is the most common treatment that doctors will recommend for patients. But there are other treatments.
Yes.
Sure.
So yeah, we just to add to that, the CPAP. If you just imagine a tube that's flat, when the air blows through it, you end up with a round tube. You get more air in. But like Dr. Montalban says, the compliance is very low. I believe it's about 40%. So it's a 60% failure rate right there. So there's also other problems where it's difficult to travel with. A lot of people, their eyes feel dry or irritated. Other things would be just to travel with it. There's a lot of, you have to bring water. You have to have water available. Then you have to bring it out. Like say, if you want to go camping, it's nearly impossible to go camping with it, right? So we do offer an oral appliance, a sleep oral appliance. And I believe you have a video of that.
Yeah.
Yeah.
So I believe it's this one.
So this is the Prosomnus. This is the one that we offer. And basically what this is what's called a mandibular advancement splint. And it's 2 pieces. That was a very short video. Just to show, Dr. Nolido has an example of that on a model that she can show. This is the one that we offer our patients here, which is nice because it's not connected. And those 2 pieces that come together are what help bring the jaw forward. So when they go to close, it automatically brings the jaw forward. And when the jaw is brought forward, it pulls the tongue along with it, which will open up the airway so the tongue is not falling backward into the airway. So we like that particular appliance because it is 2 separate pieces. We can titrate the patient. See one.
So they come out kind of like night guards, but 2 of them.
Right.
And then they come in different sizes. So, and if you just imagine your jaw moving forward just a little bit, and like Dr. Montalban says, it pulls the tongue forward, and at the same time, it also tightens all the muscles in the mouth. So when you lie back, they don't fall back. It also, if you move your jaw forward about 1 millimeter, that's equal to a 3 millimeter gain in your airway. So, allowing more air in. And like Dr. Montalban said, we titrate. So usually we open up just a little bit. And every time the patient comes back, we change out one of either a lower or an upper, and which will bring the jaw forward just a little bit more forward and down, allowing, again, more air. So another millimeter, another 3 millimeters in your airway.
Yeah. So
Is that your own design?
So this is our favorite. This is Prosomnus. This is what we use. It's very comfortable. It's very thin. Again, it's like having a mouth guard, a neck guard in the mouth, and then there's 2 of them, but they're both very thin. And again, very easy to go camping with.
Right.
You don't need to bring anything else, just a little container for the 2 pieces.
So we prefer that one. There are a lot of different appliances out there. They're all different, that they've gone through different phases of what kind of appliances. That's just our favorite, and that's made by Prosomnus.
Yes.
There are other appliances that are, I don't know if you can see that are kind of more connected, where they pull the jaw forward with these connections. So these are other types of appliances that some doctors have made for their patients. All of these things are custom made.
Right.
We don't prefer this only because there's not really an easy way to change these out. They get shorter and shorter, and that's how they're brought forward. But as you can see, it's like a rubber band holding the mouth closed.
Right.
So sometimes for patients, it's not as comfortable. So we just like the Prosomnus a little bit better. I don't know if you want to show the video of like how we make that.
You mean the video of the device?
Of the scan.
On the scan.
Okay, so today we'll be doing a 3D scan for your sleep appliance, and it shouldn't take that long. We'll do upper, lower, and then also the bite.
Okay.
Okay. If you need a break.
All right, so this is a 3D scanner. So he's just going to go ahead and scan the upper arch and the lower arch. And then usually after this, a doctor, one of us will go in and do measurements with something called a George gauge. And it just measures how far a patient can bring their lower jaw out and how far they can bring the lower jaw back in. And then we just measure about 50 to 60% between the two measurements. And that we use that number as our starting point. And here he's done. You're going to see, we're going to wrap around and we're going to see the screen of the computer here so you can see what the scan looks like shortly. You can see a little bit of it there right now. I think the scanner had locked a little bit at this point, but it's, there we go. Oh, it's still locked a little bit here, but essentially the teeth are scanned and then that's sent directly to the lab. And then about 2 weeks later, the appliances are sent back. And just to let you know that even with CPAP and with these appliances, there can be some bite changes that can occur. The difference is with the CPAP, there's no dentist that monitors the bite change. But with the appliances that we have, these also come with some a morning appliance. Okay. So after you've worn it at night, you take that out. Your jaw is going to, your muscles are going to be used to having your jaw forward and down. So you have to wear the appliance. It's actually best to kind of have like a thinking man, do a thinking man pressure on your chin for about 5 minutes, and then wear the morning appliance to kind of train all the muscles to go back to where they were before. So you have your original bite back, because again, it is a risk for both CPAPs and for the oral appliances. But again, we monitor patients very carefully, and even with the sleep appliances, if there is a bite change for most patients, it's very minor. But even if you have major change, a lot of orthodontists will not really change it back. It's more important to kind of get that air and live a very nice long life as opposed to, changing that bite back. So, right.
So the main resolution depends on holding the tongue, right? I mean, if you hold the tongue.
Holding the tongue. Yes. Holding the palate. Yes, when you move forward, though, all those muscles tighten, and when you go lie back, that palate stays in place and that tongue stays in place.
Right.
Yes.
Right.
Mm-hmm.
There is another appliance that they came out with that is actually physically holds the tongue out of the mouth, but they don't really market it. It was one of the first appliances that they came out with because basically it looks like something that then they're sticking their tongue out while they're sleeping. So a lot of people didn't like that. But that's the idea of these splints is the tongue moves with the jaw so that
Right.
the airway will be more open. But even in the reports, the recommendation is that patients don't sleep on their backs because that's the most common time for the tongue to go backwards. So even if they're wearing an appliance or in a CPAP, it's still best to somewhat sleep on the side, so that way the tongue doesn't fall to the back of the throat.
If you have milder sleep apnea, you can try things like you can buy this from the store or Amazon. I don't know if you guys have Amazon there, but either T-shirts that they sell with a little ball in the back to prevent you from, from lying on your back. You can get a wedge pillow so that you're up a little bit more. If you have those special beds, the number beds, they'll bring you up a little bit more so that you don't have too much of a collapse going on there in terms of your tongue and your palate. So there are things you can do if you have like mild,
What would be
milder side.
the perfect angle for a person when he lies down with on his back to put the right size of a pillow? What will be the correct angle? Because many people see information on the internet saying, no, this is therapeutical, you should sleep on your back like this, you should sleep like this, so there's so many informations out there just to make it real, saying that this is the proper way. So what will be the proper way of sleeping regarding the angle if you sleep like on your back?
I think that's different for everyone. I think that's very specific because
Right.
everyone's tongue is a different size. Everyone's uvula is a different size. Maybe they have, tonsils, and large tonsils back there. I think it's very specific to each patient. But I know the wedge pillows, they're pretty much all the same angle, and you can add a pillow if you need a little bit more. But like Dr. Montalban said, also the side sleeping is also very, very helpful.
Yeah, that they do recommend side sleeping more so than back sleeping. I mean, that's not to say sleeping on your back is bad. It's just if a patient has sleep apnea, they're more likely to have an event if they're sleeping on their back. But somebody who doesn't have apnea, that's not really an issue. So there's no perfect sleeping position. It's just that, or a perfect angle, because as Dr. Nolido said, everybody is different. So not everybody has sleep apnea. So the people that don't snore, they can sleep on their backs fine. They don't have to have those wedge pillows or anything like that. You sleep where it's most comfortable for you. However, if you do have sleep apnea, you're probably going to have more events if you're sleeping on your back.
I just wanted to go over that because I saw in some medical forums that people overdo the angle. So that obviously makes you tiredness because the oxygen doesn't flow properly if you are too high up during your sleep because of the amount of angle that you have. So
I see. Yeah.
that's why I was going over this, because you shouldn't, in this case, you should not overdo or just go to a doctor to see what is the exact angle or proper position that you should do to sleep. I mean, I would say that's the proper answer.
Well, I think like we were saying, it's still very, very subjective. So
Sure.
there is no, everybody is different. Everybody is different. So there is no real proper angle. We just know that if they have sleep apnea, sleeping directly on the back is probably the worst angle. But just sitting up doesn't necessarily make it better, maybe for them, but other people can sleep on their back and it's not a problem. So I don't even think a doctor can know that for sure, because you wouldn't know unless you're there watching them, monitoring what angle is good for them. This is a very, very subjective thing. It's very individual to the person. So
in the lab, in the sleep test, however, we do see numbers. There's a difference in the numbers when they're lying back or when they're sleeping on the left or when they're sleeping on the right. That we would have an information. I think a good answer would be take a sleep test.
Right.
Yes,
And
'cause that's part of the information that we do receive. Yeah.
right. So,
So on the sleep test, it comes out all the information, so you can acquire even what was the position that the person was
Correct.
sleeping on.
Correct.
Okay.
And what your AHI number was when you were sleeping on the left.
Okay.
And if your if your air went down, your oxygen saturation went down when you were sleeping on your left, on your back, on your right, things like that. That's all available on the sleep test.
Amazing. Amazing. So as you can see, we went through diagnostic, we went through what is it, we went through what are the possible causes, and went through the scanning and possible treatments.
yep.
So what other advices would you doctors give for people that might have symptoms or already have apnea, or even people sometimes that are doing treatment but you don't have so better results? So what kind of advices would you give regarding this?
Yeah, I think just healthy living, exercising regularly, and weight loss is important if you have sleep apnea. Weight loss, decreasing stress, things like that. Healthy living is the best. And if you have sleep apnea, wearing your CPAP or your appliances is very important. Yeah, just keeping your hormones healthy, getting that deep sleep.
Yeah, I mean, the biggest advice I think is if you think you have it, if you're excessively tired during the day and you snore, get to your doctor, talk to your doctor. We only talked about the two possible treatment options. There are other ones that we didn't talk about that because we're not medical doctors and we don't do that. There's certain types of surgeries and
Right.
implantable devices to help. If these other things, these are the more conservative options and non-invasive options. Weight loss, behavior management therapy through weight loss is another one. But basically what it comes down to, and the biggest advice is if you snore and you feel like you're tired all the time, even though you have a good night's rest, 7-8 hours,
Right.
and you still feel tired during the day or you're always tired, that may be a clue to maybe get tested.
Right.
So, and talk to your doctor about that.
I think also,
Also for people that have stressful jobs, because there are many.
yeah.
I was inside of a few, so I have it on my skin. Don't take it as all the risk. Just by my experience, you need to just suck it in and do as that it goes. But if you think you're not capable of doing it, find something else to do. Because I saw many people going through stressful jobs, and then they get to anxiety. Anxiety can get to obesity, and then you get other diseases just after that. So don't go over that if you think you're not capable of doing what you're doing.
Yeah.
I can tell you a story. I was in a job that long time ago. The people who were in my job, all of them had strokes, all of them.
Wow.
So I never had strokes. I took it for 2 years. It was the actual record of that job. I still have it. I done it for 2 years sanely. I didn't got insane, and I still have the merit and credit of. But it's not something that I agreed on because I saw what it does.
Mm.
There are specific jobs out there that are really stressful, and not because of what you need to do. It's because what you do has high risk, and in doing that involves many other people. Can involve hundreds, can involve thousands. So in the end, it's about you press a button and it can be very damaging. And so it and for people who I mean, we don't have that will, that strength of doing it in a smooth way,
Mm-hmm.
not feeling like the pressure on it.
Mm-hmm.
Don't do it.
Mm-hmm.
Because I saw this many times. Everyone has his own skills, everyone has his own qualities, and some people do better some other works and than other people. And I found out that in my case, I could take very stressful work and be okay. And I saw the results. I said, "My God, I went to a place that this happened on my past. Let's see what happens."
Mm-hmm.
And I took it for 2 years, and but I can tell you, it's very stressful. But the trick I did was I don't take it as, I mean, I know the responsibility I have, but I don't take it all in like I'm under pressure permanently. I mean, you cannot think like that, otherwise, you won't be able to do the job itself. And this is the main thing that people miss out. They're starting to feel pressure, they're starting to
Yes.
feel that they are constantly over stressed, and that brings you to a stage really of dramatic, which is you can go into deep anxiety. From anxiety, you can have other episodes of many other things after that. And with that, obesity. I was with a colleague that actually gave him his mindset to change over.
Mm-hmm.
And he had a doctor to treat his heart and his health. I was also helping regarding the diet, but especially mentally, I was helping because he was constantly eating all the time. It
Mm.
doesn't matter what he was doing because of the anxiety
Yeah.
made him eat, constantly. Like he was
Mm.
eating like half an hour ago, and
Wow.
just after half an hour he was
Mm-hmm.
eating again. He said, "But are you
Mm-hmm.
hungry?" He said, "I don't know. I just feel like eating." Yeah, you don't need to eat, man. You don't need the minimum time for you to eat is 3 hours. Put it on an alarm clock, and at least don't eat nothing. Only drink water or juice or whatever, or tea, relaxing tea especially. Don't drink tea with caffeine, because it make it worse.
Mm-hmm.
But just do it like that, and don't eat nothing for at least 3 hours, because you take
Yeah.
digestion for at least 1 hour and a half. If you have a big meal, at least 1 hour and a half normally
Mm-hmm.
for you to go over it. And you should not, I mean, your body does not need for the next 45 minutes any food after that still, so
Mm-hmm.
minimum is 3 hours. So with that training, he managed to go over it and not eat so much. But in the
Mm-hmm.
end, he changed jobs and went somewhere else, of course. But the main point is what do you need to do? You
Yeah.
don't need to get into anxiety. And if you have it and you see that you're overeating,
Yeah.
at least control yourself. Your body does not need food. You just eat. You can eat in the next 3 hours or four.
Yeah.
You don't need more than that. That's the main point people need to think of. But because their mind is collapsing because of the stress and the pressure and the
Yeah.
anxiety, they don't realize it. And this
Yeah.
is the main problem. What I saw in specific positions. Yeah,
Mm.
this happens in many places. I saw it
Yeah.
happen in law enforcement. I saw it happen in the military.
Yeah.
I saw it happen in aviation. I
Mm.
saw it happen even in certain positions of consulting, and I saw it happen in finance. But I've been in all of them,
Mm-hmm.
and I saw this when it comes to extreme high pressure.
Mm-hmm.
Some people just react very bad. And
Yeah.
because of that, I always advise that for certain specific positions, there should be a regulation and some specific training to see if the person is really capable of doing that. Otherwise, the
Yeah.
person is harming yourself and
Mm.
possibly harming others because not functioning properly.
Yeah.
And I guess this goes again all over what we're discussing about apnea. And in the end, it's all
Yeah.
about the same thing.
Yeah.
Uh, if you think you have it, you
Yeah.
should go and do a proper diagnostic to make sure you have a proper treatment.
Yeah.
And of course, depending what you do or what kind of job you do, you should think of changing. And don't be
Mhm.
afraid of change, because in the end, it saves your life.
That's
When it's
right.
not a matter of, oh, it's life and that, I'm afraid of changing job. Why? What
Mm-hmm.
stops?
Mm-hmm.
You have skills, you have quality, you can do whatever you want afterwards. You don't need to restrain yourself to a specific job when you feel that you don't feel comfortable doing it, and you have all this amount of pressure and it's causing you problems. Why you should continue?
Yeah.
You know?
I just wanted to add also to your question about what sleep apnea patients can do to improve things also. I think it's important to mention sleep hygiene, especially since everyone's on their computers these days, on your
Yeah.
phones and all that. So the blue light really affects sleep. Everyone knows that. And also, if you have some kind of a system at night, right, where you have to be asleep by a certain time, and if you have like a hot bath and your room is cool, it's easier to sleep, things like that. Not use your computer or your phone in bed so you're able to sleep. I mean, those are things in addition to weight loss, in addition to exercising, eating healthy and all that. I think sleep hygiene, just because it's so widespread now, everyone's on their phone. And sometimes I'm on it too at night. I'm like, oh gosh, stop. You have to be in bed. It's, that sweet spot, like 10:30 to 3 is when, you can really get some great deep sleep there. So,
Yeah.
yeah.
I actually refrain myself because I actually do this wrong. Sometimes I take calls at 2 a.m., 3 a.m., sometimes 4 a.m. So, yes, you shouldn't do that. And I know it's wrong, but in the end, there are some calls that I really need to take them. So it all depends on what you do again, So,
Right.
but is it healthy? No. I'm perfectly aware that sometimes what I do is not healthy for me at all. But someone has to do it. That's the other part too. So, I mean, it's kind of like, so I do that kind of balance. Someone has to do it. Yes. Is it still done properly? Yes. Okay. So we continue doing it. But is it totally healthy? No, it's not. And you should not do that. This is not the perfect example, but you should not do that. And I know many people that do it. And you should always have, especially now with modern phones, you can put non-disturb for a certain hour to certain hour. So you remove all the sounds of all notifications from, for example, as the Dr. Nolido said, from 10 in the evening to 7 in the morning when you wake up, or 6 in the morning, and you don't have any sounds, so you can sleep. And you should do that. You should really do that because that's the healthiest thing to do. Whoever calls, if it's not something related that the world's going to end, you can take the call in the morning. You don't need to take the call in, during the night because it's not critical. Because I'm saying this because there are people who are very, very responsible, and because of their character, if they have a sound, they immediately going to check. So you don't need to. I mean, it's going to be there still. If you have an email that arrives at 3 a.m., it's still going to be there in your mailbox when you arrive there 8 a.m. So you can reply by then. And everyone will understand that everyone needs to sleep, right? I mean, the world is 24 hours, despite that we are in different time zones everywhere, but everyone sleeps. So, in the end, everyone needs to understand if there's a different time zone, this person, when you arrive to the office, will answer. You don't need to answer in the middle of the night for you. So I'm saying this because I've done this myself, and I know this is not proper. So I'm just giving the perfect example what you should not do. So that's, just wanted to compose that.
Sounds good.
So I think we went through most of general knowledge, what is apnea, what you should look at, what you should be aware of, what are the symptoms, what you should do when you have the symptoms, what are the treatments, what are the machines, the appliances. So what else we should know about apnea that we haven't told yet?
Let's see. I mean, like Dr. Montalban, there's a lot of options out there.
Right.
But, not just, we mainly deal with obstructive sleep apnea. There are different types and there are different reasons for it. So if you have your symptoms, and again, we screen it very easily, but you can have other reasons for not sleeping well. You can have enlarged tonsils, enlarged adenoids, deviated septum, things like that. So it's really very important to be open to, to the possibilities of, being screened for things, because it could, be more than just obstructive sleep apnea. So I just want to use my nephew as a story. Many years ago, I used to look at him all the time. I'm like, gosh, I'd look in his mouth. I'm like, gosh, you're so tight in there. It's so small. And every time I would visit, I'd say, gosh, does he sleep well? And finally, they, took him to the doctors, and lo and behold, he has, moderate sleep apnea. He finally, and it was caused by his tonsils, enlarged tonsils. So he had the tonsils removed when he was 9, and now he sleeps great. He doesn't snore, and he actually tells his mom, I feel so refreshed. Like, even as a child, he was able to say, hey, I feel great. So it's so important to be open to being screened and tested and and treated. So yeah, and that's the beauty, right? If you catch it really early on.
That is definitely one thing that we do also, I think, want to let people know about. We talked mostly about adult obstructive sleep apnea. We don't treat it, but it's also important to understand that children can have it as well. And for them, it's very important because of their development, because they are having brain development all throughout their lives, while from, infancy to adulthood. And that's the most important time for them to be getting their oxygen and reparative sleep. And having that obstruction, like she was saying, of the tonsils or the adenoids can be very damaging for them. There are a lot of doctors that treat that, but they also need to be tested for it. They also parents need to be aware that this is also a very important thing for their children. So it doesn't just affect adults. Yes, it affects a large majority, millions of adults, but it can affect children. So we don't want to take away from that. Even though we don't particularly treat that, there are other doctors that treat it. There are other dentists that treat it. A lot of the ENTs will treat it with some sort of surgery. There are other, and we were talking about other treatment options, not just for children, but for adults, surgeries that involve opening up the airway, putting implantable devices to help open up the muscles of the airway. So those are other options, but more invasive. So they involve some sort of surgery, which a lot of people are a little bit hesitant to do, but it is still an option out there. So there's more than just the CPAP or the oral appliances that are treatment options for patients with this problem.
Yes.
Awesome. I just have one last question. So, of course, from person to person, every person is different. Do the people with larger tongues are more prominent to have apnea, or is none related at all?
Oh, it's actually one of the highest risks.
Okay.
Usually when we go in, we look straight at the neck and straight at the tongue, and then we look and see if we can see the back of the the uvula and all that. So the less of the uvula, the more likely you have sleep apnea. And also, if you see the tongue and it's got scalloping on the sides, that's also high risk. Or if it looks like it's so large, it's got a fold in the middle, that's also very high risk for sleep apnea. So that's when we start talking to our patients about, hey, do you sleep well? Do you usually sleep on your side, on your stomach, on your back? We ask those questions. We start screening, and we screen everybody, but right off the bat, neck, tongue, back of the throat.
And also the jaw, you can see it in their jaw structure as well. Because even if they're a skinny person, if their jaws are very narrow, their tongue can be a normal size, but if their jaw is very narrow, it still cannot hold almost like a normal sized tongue. So we'll also see that if the lower jaw especially is narrow or small, you'll see patients like that will put them at a higher risk. So there are anatomical signs that we look for. We can almost look at a patient's almost immediately and say, "Ooh, they're at risk."
Yeah, just even from the profile, we can tell even from just looking at the profile.
Exactly. So those definitely, for sure, the size of the tongue is a big one as well.
Yeah. That's probably number one, right? That's probably number one. Number two is the next.
No, I mean, my question, I think it comes with nature, because you're born with your own tongue. I mean, that's the way you were born.
Yes,
exactly.
That's true.
Exactly. So that's why those are the anatomical things that we look at. Your bone structure, you can't really control that. Your tongue, you can't control the size of that. The neck, certain people, even if they're thin, have more prominent necks, or their jaw is a little bit retruded or pushed back, and that's all the way that they were born. So, even if, again, it doesn't have to be that they're overweight, they can be skinny and they still have this anatomy that puts them at higher risk, So if they get older,
there is a surgery, just what Dr. Montalban said about having a retruded chin and upper arch. There is surgery to correct that as well. And it is invasive, but it is very helpful. I know some patients and I know some friends who have had the surgery done. Would really change their lives. They're no longer snoring. But just to, to move the jaw forward and the upper arch forward, creating more space for your tongue and more airway.
Amazing.
Yeah.
So I think it was amazing conversation to do episodes. I mean, it was my first on medical. For me, it was very, very insightful, and I was very thrilled about this because in the main aspect was for people to be aware. Let's not increase the statistics. There's already 938 million people out there suffering from apnea. Some people don't even know they have it. And let's not increase that, because in the end, it's all it takes is if you're not aware, if you don't care, in the end, of course, the statistics will increase, and that's not good. I mean, the number is already overwhelming. Let's not, overpass the current number. Let's try to decrease it a little bit.
Yes. For sure. Yeah.
So, doctors, it was very, very exciting conversation to do episodes. I really appreciate the attention and your perception and your insightful information as experts. To dedicate this time, to this, because I think it's very important for people to be aware out there. So I'm very thankful for this moment and the previous one, and I'm truly appreciated to have you on this show.
No, thank you for the opportunity to allow us.
It's truly my pleasure. Believe me, it's really my pleasure.
Thank you so much. Yes, it's wonderful. Wonderful experience. Thank you.
Absolutely.
So before we go, what will be your power message of both of you today?
You want to go? For me, I said it the last time. It's so easy for us to screen, and getting tested is a lot easier now, especially if you're mild to moderate. And then getting, an appliance now. Before, when we had to take impressions with the gummy material. Now we can just scan it, and then we have to go straight to the lab and they just print it. And, it's very easy to treat and easy to diagnose, and come on in, get checked out if you're not feeling so great.
Yeah. My take-home message would probably be, snoring is not always just snoring.
Yeah.
So, and if you're snoring or somebody told you that you're snoring and you're always tired, start to think that there might be something else going on that's
Yeah.
affecting your health, your
Yes.
life, and the lives of those around you. So that would be probably my take-home message. And certainly snoring is not normal for children. So if your child snores, ask their doctors, their pediatricians about it, and just to get tested. Yes, absolutely.
Awesome. Doctors, once again,
Yeah.
thank you all again
Thank
for
you
being
so
here.
much.
Thank
sharing
you.
all this
Thank you for having
information.
us.
Thank you for the opportunity to speak about this.
It's really my pleasure, and I hope everyone that will listen will be for sure very insightful and very informative for everyone to be aware, and not let's and endanger more the statistics. Let's try to decrease it, and that's the main objective of these
That's right.
2 episodes.
Absolutely.
So again, thank you all for watching. Catch you on again on the next one. Thank you, doctors. It was really my pleasure.
Thank you.
Bye bye.
Bye-bye. Thank you.